is she doing? I mean, Olivia, if we talk about the number of nurses, then we have to equally go back and look at institutions that put them there. You go to KMTC and other medical colleges that do exist that churn these medical professionals into the system. How many are we graduating, and are we seeing equal measure in terms of absorption into the industry? Is it that we have not graduated enough professionals to meet the numbers that we have, or is the problem absorption within government?
When you talk about training and training to skill the healthcare sector, you don't. I wouldn't talk only about nurses.
Yep.
Although nurses are the custodians of the hospital, and we also can't run without them. There are so many cadres in the hospital. In different sections that generally as training institutions we produce a lot of graduates, but the absorption after internship, let me say so, after a student has fully trained, has been to internship, then they stay home for quite some time, and the health sector, as we say, is understaffed. But still then there are people to be employed. So at the end of the day, there is no match between churning out and absorption. So what I would say is that training institutions are doing their best to train to standard the health force that we require, but then our trained personnel remain out there without being able to be absorbed to assist the country well in terms of treatment.
Why aren't they absorbed?
Policy.
What?
Of course, you know they are not absorbed because there is no job which is advertised. So,
no, I don't know. I'm asking why. Why?
Are they not absorbed? Yeah.
Why do we have training facilities churning out medical workers, whether they are doctors, nurses, radiologists, clinical officers, nurses, and then they're not absorbed? They're being trained because I would assume that they're being trained. I'm assuming that we're doing all of these things based on data and information. So they are being trained because at the end of that training, there is a need, right? And then there are people who then can get the skills to then be able to do this job. So why then at the end of the tunnel is the absorption not happening?
There is a process of human resource acquisition, be it in the government sector or the private sector. The need has to be announced that now we need this. And then we have to say we are ready.
The need has been announced. It is shouting. The need is shouting.
No,
sorry, Olivia. Come on.
It's shouting, yes.
That we have been told that the disparity is there. What that number is baffling. I've even forgotten it.
I think
3 to 10,000 to 100,000.
To 100,000.
Okay, let me not say the need. Let me not say the need. The need is there, but the decision to address the need is what is not there.
Now we're talking.
Let me put it, Olivia, let me put it differently for you. As we answer the why question. Because clearly, we have training institutions, right, which are up to standard. So the people they train and graduate are competent to be our nurses and other cadres of service in the healthcare ecosystem. So we have a production line. We have consumers, because we have institutions that are required to fill these positions for them to efficiently deliver the healthcare service to Kenyans. So we have consumers and we have market, because the facilities are the market where these services are absorbed. The consumers are the patients. We have money, because every project needs resources, right? From our taxes, where we see budgetary allocation. Like now, we have 177.8 billion allocated to health. A portion should go to part of this recruitment. The question is why, simply, are we not seeing this qualified, competent, certified person who is being demanded by the chairman to be deployed, and the resources are being provided? Why are they not working today?
Let me answer that.
Yes.
You see, you are saying Kenyan taxes, and you are even saying how much has been allocated to health.
Right.
But in health, there are so many other issues to be tackled apart from human labor or workforce. And then it is about prioritization of the need. Yeah, the need is there, but then we need to do this allocation in a manner that every sector will be covered. But then now, when we are deciding, is when we decide now, this time we are going to get this amount of labor based on the allocation we have. And as Seth will also tell you that the allocation is not enough.
So